It is Monday, April 27th. Welcome to our daily COVID-19 Task Force update. Today on the program, Lloyd, Phillips, and Lisa Westaway will be here with some developments. Also, for the first time, Don Montour-Lazare will be joining us as well. So, as we start a new week, we start a new report, and Lloyd, it's all yours.
Thank you, Joe. Kahnawake, and welcome to another week here from the Kahnawake COVID Task Force. Certainly a beginning of another long week, and I feel the strain in our community. I know these past few weeks and several weeks have been tough on our community. And like I said yesterday, we're certainly on the right track, and things are certainly going in the right direction. This afternoon, I just want to address a couple of issues with the community. First and foremost, regarding the statements that the Premier Legault had made regarding the Quebec schools. He announced today that on May 11th, that schools outside the Greater Montreal area will open on May 11th, and those schools, I believe, on this island of Montreal will open on May 19th. I'm just here, first and foremost, to confirm with you that the Kahnawake schools will not be opening for this year. I spoke to Robin Montour, the Director of Education, and it was in agreement that based on the health, the safety, and the plan that Kahnawake is developing, that this year the Kahnawake schools will not be opening. They will also be looking into other options in terms of how that impacts on the daycare services being provided in the community. And as a matter of fact, Robin will be here tomorrow to go in much more detail with you on the overall plan moving forward. So I'm looking forward to hearing that information from her. We also will be discussing more issues in and around the daycare services for the young children with step-by-step. Because the Premier Legault has also made comments regarding the daycare services opening up within the province. But again, as we said from the beginning, whatever decisions are made for the community will be done by the COVID task force. But we'll be consulting with Dr. Anik Gauthier as well as the whole task force to ensure that the decisions are made are in the best interest of our community. As well, the Quebec government had announced that they are going to be releasing tomorrow their economic reopening plan, and what's that going to look like moving forward? Again, we're still not sure, but again, remind the community that for the past week and a half or so, there has been a group of Kahnawake who are working very diligently on a plan that would be the Kahnawake revitalization plan for the economics of our community. So that plan is in motion. It is working. They're working out the principles and the procedures. They will be reaching out to other business stakeholders in the community, and we're going to create a Kahnawake plan. They are scheduled to come back to the task force this Friday with an update, and obviously at that point we'll do proper updates to our community. But again, keep in mind, we don't want to get ahead of ourselves. It is important to note that this plan that's being developed is there. That will be something that we need to have in place, provided that when we decide to turn the key and decide that we have to enter phase 1 of this plan, it will be based on a date yet to be determined, but again, that will be based on many factors, but obviously input from our medical advisors, input from the task force, and science will lead the way moving forward, again, best interests of our community. With that in mind, as well, we had a meeting today regarding all the health and safety inspectors within the community. What we're going to be doing moving forward is we're going to be consolidating the intake process regarding the inspections to ensure that any health or safety related inspections within the community is done in a much more coordinated fashion to ensure that nobody falls between the cracks, that there's not a duplication of services, and that all the information regarding the COVID-19 directives are being followed in a proper manner. Not to say that they weren't being followed in the past, but we're anticipating moving forward when we gradually start evolving and opening up businesses in the community. There's going to be a need for checks and balances in terms of ensuring that the safety procedures are in place, the health procedures are in place. So we want to make sure that the inspection services are out there first and foremost to ensure the safety of our community in all the sectors, from the construction to food services and everything in between. Again, because we are following what is best for our community. And I'll say it again, because our population, our community is much more vulnerable than any other community in and around Kahnawake. So there are some developments happening. I'm glad on one hand to say we are looking forward, we're moving in the right direction. We have to put these plans in place for our community, but at the same time, let's be careful, let's keep on track, let's stay the course, because only together we'll get through this. Kahnawake, see you tomorrow.
All right, thank you very much, Lloyd. And just a couple of notes. As Lloyd mentioned, Robin Delarone, the Director of Education, will actually, well, he mentioned her, but I can tell you that she will be here tomorrow to explain what is expected to happen with education, since there will be no classes in Kahnawake this year. So obviously, very big directive today, and she will be here to explain it. Also, just a mention among the initiatives announcement today, if you didn't see it, the Kahnawake COVID-19 Task Force announced that garden soil deliveries are added to the construction and landscaping and gardeners directives that were given out earlier. If you'd like to look at any of the directives, they are available at covid-19.kmhc.ca. Also, you can see them at kahnawake.com. All right, so coming up next is the manager of outpatient care at the Kahnawake Memorial Hospital Center. You've heard her on the radio, but you'll see her for the first time on our daily update. Let's welcome Dawn Montour-Lazare. Dawn?
Yeah, Joe. Okay, so the reason I'm coming in today is I'd like to talk about our clinic. We've had, our clinic's been operating quite regularly since the beginning of the COVID-19 outbreak. And what we're doing right now is trying to accommodate people to get appointments with physicians. So our lines are still open. You call in and you'll get an appointment to get a phone consultation. Most of the doctors are consulting with their patients by phone. And if they feel that the person needs to come in, then they will have them come in. So if anybody has, a cut or things like that that need to be taken care of, you can still come to the clinic. You would have to call ahead of time first to make an appointment if you can, and you will get screened at the front door to see whether or not you have any symptoms of COVID, if you've been exposed to anybody, and if you're around anybody who has respiratory symptoms. The other thing is that when you call, the secretary is going to tell you that you will be getting a call anytime after 10 o'clock. That's to say that we're not giving you an exact appointment, but that you will get a call sometime that day. So you need to make sure that you give a phone number that is valid for the day that you're going to be getting the call. So if, let's say, you're making the appointment for only Friday and you plan on not being home for whatever reason, you have to make sure that you give them a cell phone or some other phone that you can that the person can reach you. We've had quite a lot of times where the physicians are having a hard time reaching patients because they're not giving the right numbers, and it makes things very problematic, and then people are calling to say that they haven't received a phone call. The other thing is to know is that when we do call, most of our phone lines do not have caller ID, so more than likely you'll see no caller ID or private number written on the phone. So people might tend to have a tendency not to answer phone calls when they don't know who the person is. I know we have that problem in baby clinic where people don't want to answer the calls. So it's important that if you're planning on having a phone call from your physician, that you make sure you answer these calls. The other thing is that our blood test lab is still open. The only difference is from what we were doing before is we're taking appointments only for the lab. The reason for that is we want to try and limit the number of people that are in the clinic in the waiting room at a time. So the appointments are 10 minutes apart, and we ask that you try and respect the time so that we don't have a pileup of people showing up at the clinic. Prenatals, We still have prenatals going as they normally would. So the doctors are still, Dr. St. Cyr is still seeing all the moms as they normally would, because it's hard to do things like weights or the heights of the fundus to see how big the baby is and to check baby's heartbeat unless you have somebody show up at the clinic. When possible, we try and do things over the phone. We also have Karine as well too, who's doing a lot of things over the phone. So if you have questions, if you're worried about anything, you're more than welcome to call the clinic and ask for Karine and leave a message with her, and she'll get back to you. Our Well Baby Clinic also is still operating as normal for the most part. We're only seeing babies that need to have vaccination, so babies coming in for 2, 4, 12, and 18 months are coming in like they normally were. Everyone else is either getting a phone call appointment, or they're either getting a phone call or another appointment just to try and do as much of it to do over the phone. And if they have a vaccine that needs to get done, we would have them come in even just for the vaccine. And I think that's all I have to cover right now. So, to you, Joe. Now we'll go.
All right, thanks, Don. Always nice to see you. All right, so our final presenter on today's update is the Executive Director of the Kahnawake Memorial Hospital Center. So let us welcome once again, Lisa Westaway. Lisa?
Thank you. Good afternoon. I wanted to give a little bit of information about the testing site. So we're underway trying to make preparations to be able to do the health checks in all of the households in Kahnawake. As part of our media blitz, we'll be putting a lot of information into newspapers. Here we'll continuously repeat on the radio as well. And what we'd like to do, because we know that there are a significant amount of people who do not have landlines, is do a campaign that's a tell a friend campaign. So what we're asking is that each of you who happen to be listening here today, that you tell 5 friends that that KMHC is organizing this health check, and so we can make these phone calls, we can get through to you, and for those who don't have landlines, that they actually send us a phone number that we can reach you at, so that we can continue, so that we can make sure to get through to as many people as possible. Again, the phone number is 450-638-3930, extension 2296 or 2275. So if you don't have a landline and you've told 5 friends, and if they can call us at the testing site to give us the cell number, so that we can do that health check. Secondly, I just want to talk a little bit just to complement what Lloyd has already mentioned to you. Just to say that, over the past many weeks, I know many of you have put a lot of faith in the task force. You've put a lot of trust in us, and we're coming upon some very difficult weeks where we're going to have to make difficult decisions as well. We're not ready to move forward as quickly as the province is moving forward, but we hope to bring some important information to you this week, and we ask just that you continue to keep your faith in us. We are very conscious of all of the elements and variables that are impacting the community at this particular time, and we're going to be very careful to try to meet the health economic needs of everybody as we move forward. Of course, as we've mentioned, focusing really on the health of our community, considering that we're different from everywhere else. And as I mentioned on the radio this morning, our elders and our most vulnerable population, no matter what decision we make, it always has to be in the best interest of those people. So again, we thank you for the trust you've placed in the task force. We're many people who work together to be able to come to you with these directives, and we ask that you continue to do so moving forward. So thank you.
I thank you very much, Lisa. And just a note that, boy, this one's a little more difficult to open. Just to let you know, though, that we're still washing our hands, but mostly doing it off camera. We have a big, giant dispenser over there, and that's what we've been doing. Okay, a note for tomorrow. Robin Delarone will be here to talk about the school situation, education. Also, for the students who go to school outside of Kahnawake, that will be discussed as well. So it's going to be an overreaching and just a comprehensive discussion from Robin, so we're looking forward to that tomorrow. Just wanted to mention that one last note, that if you're someone who's looking to speak to someone, if you have any sort of anxiety or you just want to talk about the issues of the day and how they're affecting you, you can contact Let's Talk Kahnawake, and that's an initiative through Sagotiat again has Community Services, and they have a number that you can reach from Monday through Thursday from 5 to 8 p.m. That number is 514-235-9607. We'll repeat that throughout the next coming days. Aside from those times, of course, you can still speak to anybody. They have people on staff and on standby to speak. But at other times, you can contact the Kahnawake Peacekeepers at 450-632-6505, and they will put you in touch with someone who you can speak to. So that's it for today's update. We thank you for joining us. We'd like to thank Don Montour-Lazare for joining us as well for the first time on our update. And take care of yourselves. We shall see you tomorrow at roughly the same time. Nyao ko adano onigiwai.